cholera, a waterborne disease, has plagued humanity for centuries. Today, it continues to cast a long shadow over many parts of the world, including Nigeria. This infectious disease, often characterized by its rapid and severe dehydration, poses a significant public health challenge, particularly in areas grappling with poverty, inadequate sanitation, and limited access to clean water. Recent years have witnessed devastating cholera outbreaks in Nigeria, leaving a trail of suffering and loss in their wake. The country, already burdened by various health concerns, finds itself on the front lines of a persistent battle against this preventable disease. The impact of these outbreaks extends far beyond immediate health concerns, affecting socio-economic stability and hindering development. The urgency to address this crisis cannot be overstated. Understanding the causes, strengthening healthcare infrastructure, and implementing effective prevention and control measures are paramount in mitigating the impact of cholera and safeguarding the health and well-being of the Nigerian people. Cholera is an acute diarrheal illness caused by the bacterium Vibrio cholera. This bacterium infects the small intestine, leading to severe diarrhea, vomiting, and rapid dehydration. The hallmark symptom of cholera is profuse watery diarrhea, often described as rice water stool due to its appearance. Transmission of cholera occurs primarily through the fecal-oral route, typically via contaminated water or food. This can happen when human waste finds its way into water sources used for drinking, cooking, or washing. Poor sanitation, inadequate hygiene practices, and crowded living conditions significantly increase the risk of cholera transmission. The severity of cholera lies in its rapid dehydration effects. If left untreated, it can lead to death within hours. Fortunately, cholera is a treatable disease. With prompt oral rehydration therapy, ORT, which involves administering a solution of water, salts, and sugar, most people can recover fully. Nigeria, Africa's most populous nation, faces a disproportionately high burden of cholera. Several factors contribute to the country's vulnerability to this preventable disease. Understanding these underlying issues is crucial in developing effective solutions. One significant factor is the lack of access to safe water and sanitation facilities, particularly in rural areas and densely populated urban slums. This inadequate infrastructure makes it challenging to maintain proper hygiene and prevent the contamination of water sources. Furthermore, poverty plays a significant role. It limits access to healthcare, education, and essential resources needed to prevent and control cholera outbreaks. Climate change also exacerbates the situation, causing extreme weather events like floods, which can contaminate water sources and displace populations, increasing the risk of outbreaks. Cholera outbreaks in Nigeria are often linked to a complex interplay of factors that create a vicious cycle of contamination. Understanding these contributing factors is crucial for breaking the chain of transmission. One major contributor is open defecation, a common practice in areas lacking proper sanitation facilities. This practice directly contaminates water sources, perpetuating the spread of cholera. Similarly, poor hygiene practices, such as inadequate hand washing, especially after using the toilet or handling food, further facilitate the transmission of the bacteria. Additionally, the lack of awareness about cholera, its modes of transmission, and prevention methods hinders efforts to control its spread. Addressing these issues requires a multi-pronged approach that combines infrastructure development, hygiene education, and community engagement. Section 5. Cholera's crushing impact, a nation under siege. Cholera outbreaks have a devastating impact on Nigeria, affecting not only individual health but also the socio-economic well-being of the nation. The consequences are far-reaching and demand urgent attention. The most immediate impact is the loss of life, particularly among vulnerable populations such as children, the elderly, and those with underlying health conditions. Each outbreak puts immense pressure on the already strained healthcare system, diverting resources from other essential services. Beyond the immediate health crisis, cholera outbreaks have long-term economic consequences. They disrupt livelihoods, reduce productivity, and hinder economic growth. The fear of contracting cholera can also lead to travel restrictions and trade disruptions, further impacting the economy. Section 6. Breaking the chains. Prevention strategies for a healthier Nigeria. Combating cholera in Nigeria requires a proactive approach that focuses on preventing outbreaks before they occur. By addressing the root causes and implementing effective prevention strategies, the country can protect its people and build a healthier future. One crucial aspect is improving access to safe water and sanitation. This includes investing in water infrastructure, promoting hygiene education, and ensuring the proper disposal of human waste. Implementing and enforcing regulations for water quality and sanitation standards is also essential. Equally important is raising awareness about cholera among the population. Public health campaigns can educate people about the disease, its transmission, and prevention methods, such as hand washing with soap, safe food handling practices, and the importance of using latrines. While prevention is paramount, effective control measures are crucial in mitigating the impact of cholera outbreaks when they do occur. Rapid response and targeted interventions can save lives and prevent the further spread of the disease. Early detection and reporting of cholera cases are vital. This enables health authorities to activate response mechanisms quickly, track the spread of the outbreak, and implement control measures promptly. Establishing dedicated cholera treatment centers equipped to provide ORT and other essential medical care is also crucial. Contact tracing is another essential aspect of outbreak control. By identifying and treating individuals who have come into contact with cholera patients, the chain of transmission can be broken. This involves isolating infected individuals, monitoring their contacts for symptoms, and providing prophylactic antibiotics when necessary. Addressing the cholera crisis in Nigeria requires a collaborative effort that transcends national borders. International cooperation and support are essential in strengthening the country's capacity to combat this preventable disease. Global health organizations such as the World Health Organization, WHO, and UNICEF play a crucial role in providing technical assistance, financial support, and essential supplies during outbreaks. These organizations also work with local authorities to strengthen surveillance systems, improve laboratory capacity, and build a more resilient healthcare system. International partnerships can facilitate knowledge sharing and the transfer of best practices in cholera prevention and control. Collaborative research efforts are also essential in developing new and improved vaccines, diagnostic tools, and treatment methods. Eradicating cholera in Nigeria is an ambitious but achievable goal. By sustaining efforts, learning from past outbreaks, and adapting strategies to evolving challenges, the country can chart a path towards a future free from this preventable disease. Investing in long-term solutions, such as sustainable water and sanitation infrastructure, is crucial for lasting impact. This requires a sustained commitment from the government, increased funding for public health programs, and equitable distribution of resources. Empowering communities and fostering a sense of ownership over health and hygiene practices is essential. This includes promoting community-based surveillance systems, training local health workers, and engaging community leaders in promoting behavior change. The fight against cholera in Nigeria is not just a matter of public health, it is a matter of social justice and human rights. Everyone deserves to live in a world where access to clean water, sanitation, and basic healthcare is not a privilege but a right. We can all play a role in supporting Nigeria's efforts to combat cholera. By staying informed about the issue, raising awareness among our networks, and advocating for increased funding and support for global health initiatives, we can contribute to a healthier and more equitable future for all. The cholera crisis in Nigeria is a reminder that infectious diseases do not respect borders and that our health is interconnected. By working together with unwavering commitment and compassion, we can help Nigeria overcome this challenge and build a world where cholera is consigned to the history books. If you found this video insightful, Please like and subscribe for more health-related content.